like to bring in our next guest, our good friend, our sports medicine doctor here on the Ray Horner Morning Show. Joe, you've been with me every year I've been here.
That's right. This is actually 21 years. 95.
For you, so you were here way before me.
I wandered up here in 1995. Do you believe it?
Great insight.
So
we
much
always
fun.
appreciate and look forward to the Wednesday segments. And
Thank
Joe,
you.
top of mind this morning, let's get into the Brantley situation right away. They say another 4 months out, shut down for the season, an 11-game season for him. From what you read and everything, what went wrong here with this?
Yeah, it's a disappointing thing. So probably we won't spend that long on it. Just a couple points that I think might make sense about it. First of all, labral tears are just really, really tough. So not necessarily anything that went wrong here. They try to fix it the best they can, and it helps sometimes and sometimes not. And you have to go to a more definitive procedure. The only part that is a little bit confusing perhaps with the surgery he had done, which is a more definitive, bigger deal surgery, is that people don't understand. Now, why all of a sudden did he have biceps tendon and you said he had labrum? Is the biceps tendon, the long head attaches to the labrum. And in baseball players, very often at that attachment point where the biceps tendon, the long head of the biceps, we call it, the biceps muscles, the Popeye muscle in the front of the upper arm, it attaches to the labrum, and if there's been some damage at where that attachment is, then it continues to cause problems. And so in some people, if it was you or I, they might just snip that tendon and not use it at all anymore because we can get by without it. But in a baseball player, what they do is called tenodesis, where they actually disattach it, but then reattach it to the humerus bone. They actually attach it so it's anchored to the bone, the humerus bone, in a guy like Michael Brantley, and that will take 4 to 6 months before you're able to do heavy things like working out again, playing sports again, playing baseball again. And the question, of course, that you'll ask me that I can't answer is at what level will he be playing at when he gets back after having
that's not even my follow-up question. My follow, because I'm very interested in this part with the bicep thing, and I kind of get what you're talking about. Now, that part there of this injury, could that have been diagnosed a year ago, or did that part of this injury happen after he came back, maybe too early, after he came back and damaged that thing, trying to work hard to get back on her? Don't you know?
No, I would say that there's no smoking gun here. I would tend to say that what we find out is that we hope that attachment. We know that it's part of labral tears to have problems at the attachment to the biceps. That's why that's exactly what we do on our examination to diagnose labral tears. Is we check. People are saying, why are you checking the biceps? Because that's the attachment site. So they probably knew that in advance. Hoped he wouldn't have to have the bigger surgery, the more definitive surgery. Okay. But if they don't respond to rehab and other things, then you go the next step.
I see.
This is kind of like step 2, not a missed step or something that wasn't diagnosed.
So when they go to reattach this thing here, educate me a little bit. In the long run, does this have a good chance to be like it always was, or it will, in most instances, be a detriment or a little bit weaker? How does that work?
Well, it's not totally physiologic.
I know it's case by case.
Yeah, it's case by case. I won't wimp out on the question, though.
I like that, Jeff.
It's case by case, but in this case, obviously, it's not physiologic. So some surgeries we repair the physiology back to what it was before. This will not repair the physiology to what it was before. We wouldn't love this to be in one of our sluggers and most important players to have this done. Let's face it. It's not one of the things, and I told you at the time when the labrum was torn, the way they described that injury, that this might not. And so for a laborer who would walk in my office who has to work a job lifting during the day, I'd say there's a very, very good chance the laborer will get back to 100%. For a high-level baseball player, it's going to be tough. It's not 100% for sure. It's not physiologic. That means we're not repairing the anatomy the way it was before. And so Michael Brantley has a long way to go to get back to being a high-level baseball player.
They were saying 4 months. Does that sound about right to you?
4 to 6 months, yep.
So if it gets extended to 6 months, then quick addition takes us late spring training.
Into spring training, yeah.
Heading into the regular season again. So
I'll take it if he ends up getting his strength back and able to do the things high-level baseball players get to do. But some people never get to the very high level again. So let's keep an eye on that.
You said that a year ago, and I've pulled that quote out quite a bit when you said, Tony and I, matter of fact, were just talking about that this morning, when you said right here in this chair, and you said, I don't know if he'll ever be the same again.
Yeah.
And that kind of floored us all because we didn't think it was that big of a deal.
Well, there's just some surgeries that do and some that don't. It came up recently. I was, with patellar tendon ruptures in football players. Many of them never get back. LaCharles Bentley and many others never get back all the way. So there's some injuries that are physiologic. We repair the physiology and get them back to pretty close to the way they were before. And some surgeries that just aren't always 100%. And unfortunately, this labral tear is not.
Dr. Joe Congeni with us, Sports Medicine Center at Akron Children's Hospital. Joe, over the first preseason weekend, we had the highly decorated Carson Wentz, quarterback for the Eagles. He took a couple of big shots, and he's got they said a small fracture of the rib.
Hairline fracture of the rib. Yeah, so I just wanted to talk about that a little bit. And the reason Carson Wentz...
Because we see that in the high school side a lot.
For sure, we see it in the high school kids, and that's why I want to talk about it. Carson Wentz and the Eagles mean a lot to the Cleveland Browns this year. Every Cleveland Brown fan knows they'll be watching them.
Yes,
why are the two reasons?
We want them to lose.
Number one is because Carson Wentz is the guy we passed up on, and if he turns out to be the franchise guy, oh my gosh. And I actually think Carson Wentz is going to be very good. But number two is if we need them to lose. If that draft pick is high, we need the Eagles to unravel. That would be awesome for us. But this injury often has its genesis, the beginning of it, the development of it, in the weight room, Ray. So in a lot of our athletes, the muscles that attach to the rib cage when people are in conditioning and strength programs, and perhaps whether Carson Wentz, was in a conditioning and strength program at North Dakota State that, is at the level they have in the NFL and whatever.
Right.
So it could have been that what ends up happening. So in people that do stuff like rowing for a career or certain weight training programs, there's people that come in to see us that have localized rib pain, and we have to do further studies. It doesn't show up on a plain film x-ray. In Carson Wentz's case, they ended up doing a CAT scan, and they picked up this hairline fracture. It's painful whenever you try to move and even breathe, deep breathing initially. So they're painful, and it's going to take a while to heal. Whether it all came from somebody falling on him or a blow to the rib cage, or often in a lot of cases there will be the beginnings of a stress fracture in the weight room. The point of the matter is this will be a couple of weeks for it to heal, and the timing with him learning and getting out there and actually playing for the Eagles, this will disrupt that a little bit.
I've never had a fracture in the rib cage through all my years of sports, so I don't know how to relate, but oftentimes us sports fans, maybe not you, we say, oh, bruised rib or hairline fracture rib, that's nothing, just put a jacket on and he can play. I've talked to some people who have had broken ribs, fractured ribs, and they tell me it's extremely painful, difficult sometimes depending on the density of this break to breathe, even if you're trying to execute, especially being a pro football player.
The traumatic fractures, the ones from somebody falling on it that don't have any stress fracture part to lifting weights or anything, those are really painful. And the difference for us is if it's over a real big area, a generalized area, that's more the rib bruised ribs. If it's in a pinpoint area and a person points right to, or you're pushing on the ribs and find a spot where that rib is particularly tender, in these people that are lifting weights, often it's the fourth or fifth rib, particularly tender, then we get an x-ray, but much of the time x-ray doesn't show these, even the traumatic ones, so we have to go to an MRI or a CAT scan, and of course in the day and age of an NFL and a guy like him, they went right to the CAT scan, so he must have had a very localized, very one pinpoint area of pain, and they found he had a hairline fracture. So the point is they'll take it slower with him. He's not going to be coming back this weekend and playing. It'll be a couple of weeks to allow that to heal.
Dr. Joe Congeni with us, Sports Medicine Center, Akron Children's Hospital. Joe, we had a very gruesome looking break in the Olympic Games. One of the runners it looked to be a really bad compound fracture. And we've seen those from time to time, going way back with Joe Theismann to the basketball games and that type of thing. I mean, have advancements made on these compound fractures? We often hear about the metal's rod being inserted and stuff like that. I guess one, advancements, and two, can an athlete ever get back to playing football, basketball, baseball, whatever that might be in today's day and age?
Yeah, that's a really good question, and certainly there have been surgical advancements, and also from the standpoint of the technology we use to fix those, like you said, the rods and so forth. And although they look terrible, in the long run, they have pretty good outcomes. The bones usually heal really good as long as there's not as much soft tissue damage in those things. They heal really very well. It's over a longer period of time, and so it will be a matter of months, 3 to 6 months maybe for some of those, in this particular case that you were talking about in the Olympics, 3 to 6 months of healing for a compound fracture. Mm-hmm. I'm even a little bit more curious in the other runner that helped the person up and had the knee injury, because they actually gave her an automatic qualification, but they said from the results of her MRI that she probably was going to be unable to run and actually run in the finals. Is that the latest?
That's correct.
Yeah, but the compound fractures, Ray, to answer your question, they do very well. So again, knowing what things physiologically, what the reason they use the rod is they want to get that thing to heal a lot like, that's the term I use, a lot like what you were born with in that bone, and they do a very good job with compound fractures, our orthopedic partners do, in repairing it back to the way you were born.
All right, Joe, great stuff. Good insight this morning. Thanks for coming on.
Thanks for having me, Ray.
There you go. Our good friend, Dr. Joe Congeni, Sports Medicine Center at Akron Children's Hospital, joining us in studio.